My name is Jasper Talarba. I'm actually a foreign educated nurse. I migrated to the United States in 2002, so about 20 years. And since then, I originally came from the Philippines, if I forgot to mention. And since then, I have been in different roles in the US, from bedside nurse to nursing leadership. And my last clinical role was the director for a psychiatry department at Tufts Medical Center in Boston, Massachusetts. Today I'm going to present a topic which I think is very interesting for most of us. It's about the advanced practice nursing in Europe, and we'll try to look at the different implementation of the APN role in this region. So again, for those who are not familiar with where Teachers College is, it's actually in the heart of New York. It's Columbia University. And I am actually a EDD nursing education student there. I'm on my last leg. I'm doing my dissertation, so hopefully I'll finish in the spring. But before that, I actually have my DNP degree in health policy, global health policy from Yale University in 2015. But my concentration being in leadership, because I was a director in the hospital setting at that time, I felt that I needed to, kind of enhance my passion in teaching. The role after I obtained my DNP, I was able to work as the first foreign educated nurse at CGFNS International. Anybody of you who heard CGFNS? Couple of hands. So CGFNS International, or the old name was the Commission on Graduates of Foreign Nursing School, is the organization that does all the vetting for all foreign educated nurses who would like to migrate to the United States. So if you're going to apply either to work as a nurse or to study for school, graduate school, whatnot, you have to go through CGFNS. And CGFNS is an organization that helps with evaluating all the credentials and your qualification, your licensure. So I've been in this role as the Director of Credential Evaluation for 5 years. So basically I have seen probably most of the curricula from different countries as the director. And in that role, I learned so much. And it was mind-boggling, because even though we have one profession, the discrepancies about what we learn and the learning outcomes that we have varies tremendously, right? And once in a while, I see curricula from the graduate program, which is Advanced Practice Nursing. And these are nurses or nurse practitioners that are working in, for example, the UK or Australia, Canada, all over the world. And they would like to practice as a nurse practitioner in their country to the United States. And basically, the dilemma is, what is the regulatory hurdle, right? How can they challenge and, by licensure, practice as a nurse practitioner, not as a staff, but as an NP in the United States, right? So there's two routes. One is that first of all, you have to choose what state. There are 50 states, and so you have to choose what state in the United States you would like to practice as a nurse practitioner. So if I'm in UK, I'm in the United Kingdom, I would like to practice in, say, Massachusetts. I have to apply for my license in Massachusetts. So the State Board of Nursing, if, for example, Massachusetts, has two options. One is to evaluate your credentials, look at your curriculum, and then allow you to take the examination, ANCC or other examination for nurse practitioner. But that doesn't usually happen. What happens is the State Boards of Nursing will direct you to CGFNS, which is a well-known organization because it was created by the National League of Nurses. So they will turf you to the CGFNS International. So as the director, I will get it, and I will look at it, and the whole purpose is to identify and to determine and make a decision whether I will say if you are, as a foreign educated nurse practitioner, your education and your licensure is comparable to that of those domestically educated as a nurse practitioner. So I will write that statement and my assessment, and I will send it back to the state board, and the state board now has the final say whether to allow you to take for the ANCC examination. So that's usually the process, and it still is the process currently. So for those of you who are nurse practitioners in your country, you probably want to get familiar with the organization. And so now, as I mentioned, I currently I'm enrolled for my second doctorate at Teachers College because I really want to really be effective in what I do, at looking at curricula, at looking at the teaching, pedagogy, and methodology. But so much about that. What we are really here, we wanted to know, is that what is advanced practice nursing, and what are the variability of advanced practice nursing in its implementation in the countries in Europe. Now, there are many advantages, as you probably would agree, to implementing advanced practice in healthcare settings. For example, when I was director, when my physician, there are three physicians in my department, when one quit, guess what I did? I replaced the physician with 3 nurse practitioners. And the productivity, I just tripled with the same salary. And my medical physician was like, at first he was not happy that I'm not replacing with the physician, but I said, trust me, I need to do this. And when the productivity, skyrocketed, then he was convinced that the nurse practitioners are at par in terms of their quality of work as well as the volume of patients seen in the healthcare setting. And actually, my capstone project at Yale was specifically for this. And so if you want, I can give you the study that I've done about what I have just mentioned, because I don't want to make a claim without that study backed up. So there's a growing need for advanced practice nursing to be embedded in academic settings globally, right? Of almost anyone you ask, nurse educators, faculty members, they really wanted to, learn how to implement advanced practice nursing in their curriculum. But how do we do that? So there are actually a lot of deans who would go to CGFNS when I was there, and I do consultation on looking at their curriculum and see how that can be patterned after the nurse practitioner program in the United States. So in Europe, as I mentioned earlier, there's so much variability in the programs, or in the implementation even of nurse practitioner program. So the purpose of this study is, I have to make sure that I'm on time. The purpose of this study is to analyze the advanced practice education in Europe. We'll examine the similarities as well as the differences among the 45 countries in Europe, and then develop some recommendations about advanced practice nursing for its recognition internationally. So the methodology that I used is a systematic literature review, and we had used several databases: PubMed, CINAHL, Embase, Cochrane, Web of Science, Scopus. We didn't get much with the Google Scholar and ResearchGate, but we still used it. And per protocol, we used the PRISMA and the JPI for systematic review. And the inclusion criteria, we only looked at the 10 years back for the studies. And we make sure that they are either originating from an EU, or if they're outside of the EU, at least one of the countries included is part of the EU. And also the focus of studies about nursing, advanced nursing practice or advanced practice education. So we have gotten initially 895, and then after removing the duplicates, we only trimmed it down to 410. And then after an initial assessment for the abstract and titles, we lowered it down to 61, and in the full text, we basically had chosen 20 studies for this particular research. So advanced practice nursing has been defined by the International Council of Nurses as those individuals or nurse professionals who have obtained a graduate education at the minimum of a master's degree program and has the competencies and the critical thinking skills that made it make reasoning critical thinking skills and make reasoning abilities to enable complex decision-making skills in their clinical settings. But the implementation of advanced practice really varies. Even in the United States, we have implemented advanced practice since the 1968 when it was first coined. But currently there are, out of 50 states in the United States, there are only 23 that have full practice authority. So the rest, 27, have restricted practice, or they are still working alongside or under a physician purview. So only 23. So even in a country itself, such as the United States, there's so much variability. So how much more in other countries, right? So I know this is a busy slide, but I just want to mention this is currently what we have mostly accepted as the model for advanced practice nursing. You're probably familiar with the consensus model of advanced practice nursing, which is on the right side, which is the one with the yellow. Basically, this was created by the Working Committee at the National Council of State Board of Nursing, which is the umbrella for all state boards, but the primary motivation is to standardize and put uniformity in terms of the licensure and the accreditation and certification of all advanced practice nurses. So as you can see, it looks at the nurse anesthesia program, or practitioners, the nurse midwife, the nurse specialist, and the advanced practice registered nurse, or APRNs. In contrast, Hamrick actually also developed developed her integrative model of APRN. I apologize, this would be 1996, but when she developed it, she did not look at really the licensure part or certification. She's really most concerned about what are the competencies of an advanced practice nurse. So basically, I don't know if you can see it, but basically she looks at what is the basic requirement, and then what are the competencies of the nurse practitioner in terms of the decision-making skills, critical thinking skills, expanding. Now, after review of those 20 studies, this is what we found. There are currently 20 countries in Europe out of the 45 that have varied implementation or recognition of advanced practice nursing. So 20. So that's about 20% of countries. Then you have 25 who actually either do not have or are still thinking about having an advanced practice nursing program. So they are at the cusp of, yes, we want to have an advanced practice program. That most advanced, I would say, is the United Kingdom, Ireland, and those other countries that have developed a program next to the United States or after the United States. So there's a lot of room for improvement, right? So that's why we're talking about it, so that when we go back, we can learn about what are the things that we need to do in order to implement advanced practice nursing in our country. Here's the other dilemma. In the 25 countries, 5 of those actually train their nurse practitioner at the bachelor's level. So remember the definition of ICN, it has to be at the master's level, but there are still 5 countries that call themselves nurse practitioners. However, their education does not really match the criteria as defined by the nurse practitioner internationally. And here's another issue, the role description, and this is the most important part that we need to overcome. So the ideal role that advanced practice nurses have to do is to actually have a prescriptive authority. You can prescribe medications, prescribe treatment. You are autonomous in your work as a clinician. You can diagnose, you can make decisions for treatment, you can refer patients to hospitals or other settings or other providers. And so you are independent in your own role, in your own work, and you are accountable for whatever is the outcome of your decision. Unfortunately, in countries that we have mentioned, there are some really varying roles that they do. There's no specific job description, there's no official job title, they work in various nursing care areas, and they, even in some that they function as nurse practitioner, their role is indistinguishable from a staff nurse. Even though they may have an advanced degree in nurse practice, right? They have a master's degree, but the role itself is not different from a bedside nurse. There are also nurse practitioners that the role is that they only disseminate nursing research and do audits of the charts, they provide consultation or education, those kind of things. So the responsibilities are quite unclear, basically. I actually did an 8-month I stayed in Jordan for my Fulbright scholarship. I was there for 8 months in 2020. And I have seen they're really highly educated nurse, professors. They have nurse practice, advanced practice from the UK or the US. When they go home, they really don't practice their profession as a nurse practitioner because it is not recognized in Jordan. And I'm sure it's pretty much the same in other countries as well. The other issue that we have for nurse practitioner globally, specifically in Europe, is that there's so many titles that they call themselves. They have specialist nurse, we have an advanced nurse, there's some first assistant to the surgeon, infection control nurse, those lists, nurse educator, nurse manager. So there's not one title or recognition that's appropriate or endorsed. And that is probably why when NCSBN, Nursing Council in the United States, developed the APRN consensus model, they said, well, enough with all these titles. So that's why they only said 4: nurse anesthesia, nurse midwife, clinical nurse specialist, and advanced practice registered nurse. So 4. So either you belong in all those 4 buckets. And I think that's one of the things that Europe can learn from that, practice or that experience. So my conclusion for this study or research is that, first of all, there's a lack of practice regulation. One of the distinct, recognition of a profession or practice is that you self-regulate, right? As a nurse, we put our own accountabilities. What are we accountable for a practice? Same with, nurse practitioners. We set our own standards as a professional. This is what we can do. However, whatever is the outcome, we also are accountable. So we self-regulate. Second is that there's no agreed definition of clear descriptors, as we have previously discussed. There's numerous titles. There's no agreed competencies. Different people, different individuals, or different nurse practitioners from different countries have their own definition, as well as competencies, as well as qualifications, as we have identified. Again, variable levels of education. There's lack of a structured clinical career framework. There's no like a doctorate degree in order as an entry to practice, that kind of stuff. And finally, there's a lack of research and evaluation of the APN role. And I have seen this. I was struggling actually when I was doing my systematic review, because I initially wanted it to be just the nurse practitioner program in higher education, and only got like 5 or 6. So that's why I said to Dr. Silvano, I said, I need to expand this, not just higher education, but actually I wanted to capture most of the nurse practice program in even the practice setting. So that's why I kind of deviated from my original title. Did I miss that? Yeah. So my recommendation from this work are the following. In the countries, or in the country level, we really need to advocate for the regulation of advanced practice nursing, because without official authorization, the nurses cannot practice in their roles legally and officially. Let me give you a really short experience with this one in the Philippines, because as I mentioned earlier, I came from the Philippines. So when the Board of Nursing in the Philippines knew that I was actually part of the CGF, and I said I'm really active about advanced practice nursing, they took me and hired me as a consultant, and I developed the things that need to be done for advanced practice in the Philippines. And the regulators there, with some of my input, developed and created the bill for advanced practice nursing to repeal the current nursing law in the Philippines. So as of last year, it was approved by the House of Representatives in the lower house. It's now in the final reading in the Senate in the Philippines, and the new president, President Marcos Jr., just expressed in the recent talk with the nursing group, is that he said that once he sees the final bill in front of him, that he will sign the bill after the Senate passes that. So that is a big win for the Philippines in terms of advanced practice nursing. So that's the experience that I also want you to kind of take into consideration, that if you're coming from a country that does not have advanced practice nursing, to really sit in the table, be a policy, impact a policy. Remember, my professor once said, if you're not in the table, you're the menu. That's why nurses really have to speak up and be a, impact policy. And then, aside from recognition, we really have to be reimbursed for the work that we do, right? Because if we are not being paid, nobody will really, value your work. So that's why in the United States, you have to convince your payers, Medicare, Medicaid, or whatever insurance they carry, that they need to reimburse you for the services that you do. If you see patients, you need to be able to bill them, and you get paid for that. In the international level, I have 9 minutes, inclusion of APN profession in the international workforce database. That means that when we look at how many nurses are working internationally, we just don't say, okay, so we have like, how many, 3 million nurses internationally. We have to really break it down. We say out of the 3 million nurses, actually there are 100,000 that are advanced practice nurses. So it starts to kind of ignite the idea that, yes, there are this particular group of advanced practice, different type of nurses. We have to have clear definition of advanced practice nursing, and we have to make sure that we have a minimum level of entry to advanced practice nursing, right? So it has to be at a master's level. And the third, we have to, it's the same at the master's level as I mentioned, and we have to look at the minimum curricular content. Even though there's variability, but at the end of the day, there should be a minimum standards. And for mobility, when I say mobility, it's important that if a nurse practitioner, for example, in Thailand, and there is a nurse practice in Thailand, their curriculum should at least have a minimum set of learning outcomes, such that when they transfer to another country, for example in the United States, they could say, hey, yes, you have met this minimum requirement, so therefore you are comparable or equivalent to advanced practice nurse in the United States, and vice versa. And finally, policy evaluation. We have to, look at the different countries. How are they implementing advanced practice nursing, and learn from the experience, and even advocate for each other. So I have 7 minutes left for.
You have 1 minute left for questions.
Okay, yes. So yes, that's my references, and thank you so much for your patience.
Thank you. So Jasper, you're a very clearly influential man. If you can influence the politics of the Philippines to get advanced practice built, that's fantastic to hear that representation for our profession. Other questions for Jasper about the systematic review? Yes, just introduce yourself and ask your question.
Yes, hello, my name is Anja Moisio, and I come from Finland, University of Eastern Finland. It's not a question, actually, and I don't want to be over-criticized, not critical, but I was thinking when you were showing, we are talking now about the Europe context. And I have been working as a staff nurse in Germany, and I have been working as a staff nurse in Finland. And when I think about on the basic level, how different is the education, for example in Germany at that time it was not even bachelor's level, you were just learning by doing actually. And then I'm thinking, is it realistic to expect that we would have within this context normative APN roles?
Yeah, absolutely. and it's $1 million question. Thank you for bringing that up. It has been, especially for countries that physician-centric.
Yes.
It's really difficult to break the barrier, the glass ceiling, because if you have economically, physician group, for one, not able to, support you, then it's really like what you said. It's impossible to support having a person a nurse who has a bachelor's degree to even pursue, and for what, right? You spend more money for a master's degree, and then what's the return of investment there?
Yeah, I mean, I see the importance of the APL role. That is not the thing.
Yeah.
But for example, now I go back to Germany. They don't even have the possibility to achieve a master's education because they don't have that in nursing science, or in very few
Very few.
universities.
Yeah.
Very few.
It's on the move. It is beginning to change.
I know. I
But
was
traditionally
applying
it
for the position in Cologne, so
Yeah.
I ended up nowhere.
Yeah.
We're going to take another question.
Thank you.
So, just
Yeah.
introduce yourself.
So I'm Jo D'Souza, I'm from King's College in London, and I think that's a really interesting point, this idea of looking at a European sort of thing, and it's great to do that, but also country to country have a slightly different philosophy about advanced practice. I would say in the UK, we've very much gone down the route of a level of practice, not necessarily roles.
Yeah.
And whereas I think in the States you're very much about nurse practitioner roles.
Yeah.
So it's also about philosophy.
Right.
And in the UK they've certainly gone for an advanced practice level of practice, and how we're sort of trying to standardise that across the country through our health education in England is perhaps a different approach to how they might do it in other countries, because they have a different philosophy about it.
I like what you said, and that's probably a qualitative study coming, right?
It would be very interesting, wouldn't it, to
Absolutely.
look in different countries about
Mhm.
what takes nursing further forward.
Correct.
Fixed roles, we're thinking about, and regulation. I mean,
Yeah.
regulation is another whole.
Absolutely. Thank you for bringing that
It's a
up.
really great question, because even within the UK, some would argue that advanced practice has gone down a very medical model of assessment, decision making, diagnosis, prescribing.
Yeah.
If you're a mental health nurse in the UK, while those things may be really important, advanced practice may be more about psychosocial interventions, advanced communication skills, or methodologies for supporting the patient. Yet it doesn't get much recognition in some of the models
So
of
there's a great
advanced practice.
advanced practice mental health protection.
Absolutely, there is, isn't there? Yeah.
And it can be frustrating sometimes in countries, because when advanced practice nurses, for example, in the UK, and I've seen this happen in the United States, and the State Board of Nursing deny them to challenge the examination, it can be, a blow in the ego. Like, we actually operate in the patient. Well, how come that you're not able to allow us to take the examination? And like what you said, it's a different philosophy, it's a different skill set and focus of education. So,
Thank you. Jasper, we've run out of time, but thank you very
thank you
much.
so much.